Hello, my name is Megan Rossi, and for my Anatomy and Physiology 2 lab final project, I will be talking about celiac disease. Did you know celiac disease affects nearly 3 million Americans? This is the same amount of people affected by type 1 diabetes. Some symptoms of celiac disease include diarrhea, bloating, gas, weight loss, fatigue, constipation, and depression. These symptoms are not always experienced together. A patient can experience a combination or none of these symptoms. The most common symptom of celiac disease is diarrhea and constipation. Diagnosis. A capsular upper endoscopy camera procedure can be used, as well as 2 forms of blood tests can be used. These are a serology test, which looks for antibodies indicating an immune response to gluten, or a genetic test, which looks for leukocyte antigens to rule out celiac disease. A capsule endoscopy is a minor procedure that uses a small camera to take photos of the patient's digestive tract. The camera is about the size of a vitamin and is swallowed. Capsule endoscopies can be used to look for any damage to the small intestine. There are other forms of endoscopies, such as generic upper endoscopies, which is when a flexible tube is sent down the patient's throat with a camera attached, yet this procedure does not access the small intestine as easily. Risk factors of celiac disease include a family member having the disease, type 1 diabetes, Down syndrome, autoimmune thyroid disease, microscopic colitis, and Addison's disease. If you have an immediate family member diagnosed with celiac disease, you have a 10% chance of inheriting the disease. Also, about 83% of all people with celiac disease are undiagnosed or misdiagnosed. Triggers of this disease can be pregnancy, illness, or menopause. I personally know that I have a family member who has celiac disease, and it was triggered through a stressful work time in their life, so stress can also be a trigger of celiac disease. Normal physiology of the small intestine. The small intestine is the site of digestion and absorption. It is covered in villi, which are projections that increase the surface area and increase absorption of nutrients. They also produce mucus. With the surface area of the small intestine being increased with the presence of villi, the rate of absorption increases, and it is much faster to go through the digestion process. Villi are only 1 cell thick, making it easy for diffusion of materials. Villi are made up of tall, columnar, absorptive cells called enterocytes and goblet cells, which produce mucus, helping with lubrication of the intestine. Changes in the small intestine due to celiac disease. After consuming gluten, an immune response attacks the small intestine. This causes the villi to be damaged and flattened. Gluten is a protein found in wheat, rye, and barley. A patient with celiac disease has a complete loss of villi with flat mucosal surface. The rate of absorption is decreased and almost non-existent due to the immune reaction causing inflammation of the lining of the small intestine. If left untreated and the individual continues to eat gluten, the lining of the small intestine is worn away and can lead to interstitial lymphoma or small bowel cancer. Therapeutic intervention. The main form of treatment for celiac disease is having a strictly gluten-free diet. By eating gluten-free, the villi of the small intestine can now return back to a healthy state and continue to absorb nutrients. The advantages of this include having healthy villi and not damaging your small intestine. The disadvantages of this include not being able to eat foods such as baked goods, crackers, bread, or pasta. By healthy villi existing inside your small intestine, your body will no longer be damaging to itself. as it can now properly absorb nutrients, and the individual with the disease will no longer feel discomfort. This is done simply by removing gluten from your diet. This includes not eating many foods that the patient might be used to eating. This can be very difficult for some people, as patients cannot consume food that is even processed in a facility where gluten-containing foods are also processed. These are my sources, and to sum up my project regarding celiac disease, this is an autoimmune disease that is fairly common in the United States and affects about 1% of the US's healthy population of individuals. Also, it is just as common as type 1 diabetes is, if that puts it into a better perspective. Thank you so much for listening to my presentation, and I hope you are more educated on the autoimmune disease of celiac disease. Have a good day.